Are you feeling unusually tired? Or have you noticed some strange swelling that you just can't explain? Well, it might be more than just the usual signs of aging. Your kidneys could actually be sending out an SOS. You see, high creatinine levels are a critical warning sign that your kidneys may be under stress or not functioning as well as they should. The symptoms can be quite subtle, so recognizing the key signs of kidney harm from elevated creatinine is absolutely crucial. In this article, we're going to outline 5 major signs and what they mean for your kidney health. Number 1, fatigue and general weakness. Now, elevated creatinine is a real red flag. It indicates that your kidneys are struggling to do their vital job of filtering waste products from your blood. While creatinine itself isn't the main culprit for fatigue, its high level means that other toxins, like urea and various metabolic byproducts, are building up in your system. This toxic accumulation puts a considerable strain on your body, disrupting normal cellular functions and how you produce energy. Essentially, your body has to work much harder to make up for the kidney's reduced efficiency, and this leads to a persistent feeling of tiredness and a significant drop in your overall energy and vitality, the kind that simple rest just can't fix. Think about it this way. When your kidneys can't remove toxins efficiently, it's like asking your body to operate in a constantly polluted environment. This buildup of waste substances can lead to a condition called uremia, which has widespread effects. These toxins can directly weaken muscle function, making any physical activity feel much more demanding. On top of that, the body often triggers an inflammatory response to these accumulated wastes, and we know that chronic inflammation is a major contributor to fatigue. All this internal stress and the constant effort your body makes to maintain balance despite the toxic load just drains your energy reserves. The result? A deep-seated weariness that really impacts your daily life. It's really important to distinguish this kidney-related fatigue from just everyday tiredness. You know, occasional tiredness usually has a clear cause, maybe a late night or some strenuous activity, and it gets better with enough rest. But the fatigue linked to high creatinine and kidney problems? That's often relentless and truly overwhelming. You might feel exhausted even after a full night's sleep, or find you just don't have the energy for activities you used to love. This isn't just about needing a nap. It's a profound lack of physical and mental stamina that can interfere with your ability to concentrate, work, or even socialize. So, if your tiredness feels completely out of proportion and just won't go away, it definitely warrants a closer look. The impact of this severe fatigue on daily life can be truly debilitating. Imagine struggling just to find the energy to prepare a meal, walk to the mailbox, or even follow a conversation. People with kidney-related fatigue often describe it as feeling like they're moving through molasses. Hobbies that once brought joy become too demanding. Social events often decline due to sheer exhaustion. This chronic lack of energy can also take a toll on your mood, leading to irritability or feelings of depression, which can further isolate you. It's a pervasive weariness that significantly erodes one's quality of life and independence. Now, while fatigue can be a subtle and creeping symptom, the next sign we're going to talk about is often much more visible and a lot harder to ignore. Number 2, swelling in legs, ankles, and feet, edema. Healthy kidneys are absolutely vital for maintaining your body's fluid balance. They do this by filtering excess water and sodium from your blood and then getting rid of them as urine. But when kidney function is compromised, which high creatinine levels can indicate, this filtration process becomes inefficient. Your kidneys can no longer remove enough fluid, and this leads to it building up in your body's tissues. This retained fluid, mostly water and salt, then starts to pool in different parts of the body, especially in areas like the legs, ankles, and feet because of gravity. Medically, this condition is called edema. Now, edema that's caused by kidney issues often shows up as a puffy swelling. It can make your skin look stretched and shiny. You might notice that your shoes feel tighter than they usually do, or that your socks leave indentations on your ankles that stick around for a while after you take them off. A common test is to gently press a finger into the swollen area for a few seconds. If the indentation remains visible after you release the pressure, that's known as pitting edema. The affected limbs can also feel heavy, stiff, and sometimes even achy. In more severe cases, this swelling can pop up in the hands or even around the eyes, especially first thing in the morning. The appearance or worsening of this edema is often a direct sign that kidney function is declining even more. As the kidneys lose more of their ability to filter blood and regulate fluids, the body ends up retaining more water and sodium, which leads to increased swelling. So, if you notice new swelling, or if existing swelling in your legs, ankles, or feet becomes more pronounced, persistent, or starts spreading, that's a significant warning sign. It signals that your kidneys are under increasing stress and are really struggling to cope. This means it's time for prompt medical attention to figure out the extent of the kidney impairment and to manage that fluid overload. It's worth mentioning that while kidney problems are a common cause of edema, other conditions can also lead to fluid retention, things like heart failure, liver disease, or even certain medications. Swelling that comes from kidney issues usually occurs in both legs and might be accompanied by other signs of kidney trouble, like that fatigue we talked about, or changes in urination. Now, if swelling is sudden, painful, or only affects one leg, that could point to a different problem, perhaps a blood clot, and that would require urgent attention. Keeping a little diary of when the swelling happens, what makes it better or worse, and any other symptoms you're experiencing can really help your doctor figure out the cause. So, beyond the discomfort of swelling, kidney distress can also show up in ways that affect your digestive system, and that's what we're going to explore next. Number 3, nausea, vomiting, and loss of appetite. So, when your kidneys aren't filtering waste products effectively, again, something high creatinine levels point to, these toxins build up in your bloodstream. This condition, known as uremia, can directly irritate the lining of your stomach and even trigger the nausea center in your brain. The buildup of substances like urea can actually be broken down into ammonia right in your digestive system, and ammonia is also an irritant. This toxic internal environment is a major reason why people with kidney dysfunction often experience persistent nausea, might vomit frequently, and can even develop an unpleasant metallic taste in their mouth. All of these things contribute to significant gastrointestinal distress. A diminished appetite, which often goes hand in hand with nausea, is a common yet very serious indicator that your kidney function might be significantly impaired. These symptoms pop up because the accumulation of toxins just makes you feel generally unwell. It can also alter your sense of taste and smell, making food seem completely unappealing. This isn't just a case of suddenly becoming a picky eater, it's actually your body reacting to the internal imbalance caused by failing kidneys. So, if you find yourself consistently unable to eat properly, or even just feeling queasy at the mere thought of food, that's a strong signal that your body is struggling with a high toxic load because of poor kidney filtration. These gastrointestinal symptoms related to kidney problems often start quite subtly. You might initially notice just a slight decrease in your appetite, or perhaps an occasional wave of mild nausea that seems a bit worse in the mornings. But as kidney function declines further and those toxin levels continue to rise, these symptoms can become much more severe and persistent. Nausea might become constant, potentially leading to frequent vomiting. You might even develop a complete aversion to food, especially protein-rich foods like meat. Recognizing this progression, from mild intermittent discomfort to more debilitating and continuous symptoms, is absolutely crucial for seeking timely medical help before complications like malnutrition can set in. Persistent nausea, vomiting, and loss of appetite due to kidney dysfunction. These pose a significant risk of malnutrition and unintended weight loss. When you're unable to eat adequately, your body just isn't getting the essential nutrients, calories, and protein it needs to function properly and maintain muscle mass. This can lead to weakness, even more fatigue, a weakened immune system, and an overall decline in your health. Any unexplained weight loss, especially if it's accompanied by these other gastrointestinal symptoms, should always be taken very seriously. It can actually worsen the effects of kidney disease and make its management more complicated, which is why nutritional support becomes such an important part of care. Now, just as your digestive system can be affected, changes in what leaves your body can also be a telltale sign of kidney trouble, and this is particularly true when it comes to your urination patterns. Number 4, changes in urination patterns. As you know, your kidneys are responsible for producing urine to get rid of waste products and excess fluid from your body. When kidney function declines, and again, elevated creatinine is a marker for this, their ability to filter blood and produce urine effectively is impaired. This impairment can show up as various changes in your urination habits. For instance, the kidneys might struggle to concentrate urine, or they might not filter waste as efficiently as they should. This can lead to either an increase or a decrease in how much urine you produce, or even changes in how your urine looks. These changes are direct results of the kidney's reduced ability to do their job of regulating and excreting. There are several specific changes in urination that really warrant your attention. You might notice a significant decrease in the amount of urine you're producing. This is called oliguria. Or in some cases, particularly in the earlier stages of kidney disease, you might find yourself needing to urinate more often, especially during the night. That's nocturia. Another alarming sign is a change in your urine's appearance. If it looks foamy or bubbly, that can indicate protein in the urine or proteinuria, which is a common sign of kidney damage. And if you see blood in your urine, known as hematuria, it can make it look pink, red, or even cola-colored. This always requires prompt medical evaluation. Typically, a healthy adult urinates about 4 to 7 times a day, and the urine is usually a pale yellow to amber color and generally clear. Now, occasional variations can happen due to how hydrated you are or what you've been eating, but persistent deviations from your usual pattern are definitely concerning. Problematic changes would include consistently urinating much more or much less frequently than usual, a sudden and urgent need to urinate, difficulty starting urination, or a weak stream. Any noticeable and lasting shift in how often you urinate, how much you urinate, or how your urine looks, especially if it's combined with other symptoms like swelling or fatigue, should prompt a discussion with your healthcare provider. While many changes in urination can be discussed with your doctor at a regular appointment, some symptoms require more urgent medical attention. For example, if you experience a sudden and complete inability to urinate, that's a medical emergency. Similarly, if you're passing bloody urine, especially if it's accompanied by pain in your side or back, or a fever, that needs immediate evaluation to rule out serious conditions like infections, kidney stones, or other acute kidney problems. Taking swift action in these situations can be absolutely critical in preventing further kidney damage or addressing potentially life-threatening issues, so please don't delay seeking help. Now, beyond the changes you can see, kidney issues can also affect how you feel internally, even impacting your very breath, which brings us to our next critical sign. Number 5, shortness of breath and chest discomfort. When your kidneys aren't removing enough fluid, it can actually build up in your lungs. This is called pulmonary edema. This can cause shortness of breath, especially when you're exerting yourself or when you're lying down. This fluid accumulation makes it much harder for your lungs to do their job of exchanging oxygen. What's more, that buildup of toxins we've been talking about, like urea, can irritate the lining around your heart, that's pericarditis, or your lungs, pleuritis, leading to sharp chest pain that might feel worse when you breathe. Anemia, which is a common consequence of kidney disease, also plays a role by reducing oxygen delivery in your body, and that can contribute to breathlessness too. You know, kidney health and heart health are very closely connected. Kidney disease can lead to high blood pressure and fluid overload, both of which put a strain on the heart. This extra workload can then cause heart problems or make existing ones worse. And it works the other way too. Heart conditions can reduce blood flow to the kidneys, which impairs their function. So, if someone with elevated creatinine experiences shortness of breath or chest discomfort, it often signals an interplay between kidney stress and heart stress. This really highlights the need for a comprehensive evaluation of both systems to ensure a proper diagnosis and effective management. Now, sudden and severe shortness of breath is a critical warning sign. If you find yourself gasping for air, unable to speak in full sentences, or experiencing breathlessness along with chest pain or bluish lips, you need to seek emergency medical help immediately. This could indicate severe fluid in the lungs or a serious heart issue that's linked to kidney failure, such as acute pulmonary edema or a cardiac event. Prompt intervention in these situations is absolutely vital to manage these life-threatening conditions and prevent further complications. So please, do not delay in seeking urgent care if you experience such alarming symptoms. While these 5 signs are major indicators, there are a few other subtle warnings your body might be sending, and it's important to recognize those as well. Other signs and when to worry. Well, additional warning signs can include things like persistent, all-over itchiness, really troublesome muscle cramps, and new or poorly controlled high blood pressure. Also, unexplained confusion or difficulty focusing can be another indication that toxins are affecting your system because of kidney issues. What's particularly concerning is when several of these symptoms appear together. While one sign on its own might seem subtle, a combination, for example, fatigue along with new swelling, definitely warrants an urgent checkup with your doctor to assess your kidney health. Recognizing these signs early can make a huge difference in protecting your kidneys from permanent damage. If you notice any of these symptoms we've discussed, please consult your healthcare provider promptly for an assessment and any necessary testing. Remember, early diagnosis and management are absolutely key to preserving your kidney function. Please consider sharing this information to help others recognize the signs of high creatinine and potential kidney injury. If you have any experiences or questions, feel free to share them. And for more expert advice on maintaining your kidney health, do subscribe. Early awareness truly can be a lifesaver for you or for someone you love.